We start, though, with the COVID-19 situation. South Korea is set to see well over 30,000 new cases of COVID-19 on Monday, possibly as many as 40,000, as cases still soar despite the weekend effect when, generally speaking, fewer people get tested.
And starting today, new antivirus measures will be in place for facilities exempt from vaccine pass mandates, and social distancing has been extended for another 2 weeks. For more on this, our reporter Choi Min-jung is here in the studio with us. Good morning, Min-jung.
Good morning.
So like always, let's start with how many cases are we expecting for today?
Mok-yeon, we're expecting the daily tally to surpass the 30,000 mark once again. From midnight to 9 p.m. on Sunday, South Korea saw more than 27,700 cases. It's once again the highest ever recorded for this time period. The figure soared by more than 900 cases from the previous high set the day before, while it has nearly doubled compared to a week ago. We usually tend to see cases drop during the weekend as fewer people get tested, but with Omicron spreading rapidly, we saw record high figures over the past couple of days. On Sunday, the country's total caseload surpassed the 1 million mark in 750 days since the outbreak of the pandemic. According to authorities, it took the longest time for South Korea to reach this grim milestone out of 13 OECD countries with a population size smaller than Korea.
And Min-jung, from this Monday, stronger measures will be implemented in places of learning here in South Korea, and authorities are set to announce new regulations as the school semester is about to start here.
That's right, Mark. Starting today, facilities that do not require vaccine passes, including cram schools and study cafes, will enforce stronger antivirus measures. In places of learning, people must sit one seat apart if there are no partitions in between seats. The measure is mainly meant to reduce contact as much as possible. There will be a grace period until the 25th, so until then, people won't be asked to pay fines when caught violating the rules. Also today, the Ministry of Education will be announcing antivirus measures for the new semester. Authorities have said they will put priority on allowing in-person learning as much as possible, but with Omicron spreading, they will also allow local governments to be flexible with restrictions in their own regions. They're also considering introducing rapid antigen tests in schools in addition to PCR testing. The Education Minister said that its main goal is to minimize loss of learning and guarantee students the right to learn. However, there are still growing concerns over the increasing number of infections among teenagers. Currently, 1 in 4 people who have contracted the virus are under 20 years old. Breaking the figure down, 10% are under 10 and 15% between 10 and 20. Experts have predicted that the number of confirmed cases in this age group may reach 30,000 a day by the end of this month.
Then, Min-jung, are there any other changes that we need to be aware about?
Well, it's not much of a change, but social distancing measures are extended for another 2 weeks starting today. Until the 20th, the social gathering cap will continue to be limited to 6 people, and most businesses like restaurants and cafes will have to close by 9 p.m. Also starting today, eating and holding promotional events in department stores and supermarkets will be banned. Like the new measures implemented for cram schools, as I mentioned earlier, there will be a 3-week grace period. The age requirement for oral COVID-19 treatment will also be expanded from today. Pfizer's Paxlovid had only been prescribed to those aged 60 and over, but now people aged 50 and over can also receive the medication.
And on the treatment front, authorities have increased the number of clinics and smaller hospitals that can provide this so-called new one-stop service in a bid to try and handle this surge in Omicron cases.
Right, Mark. Health authorities have designated around 300 more local hospitals and clinics for conducting rapid antigen tests and treating patients. This brings the total number up to 780. Combined with the number of respiratory clinics, there are a total of 1,100 hospitals and clinics providing the service nationwide. Although the government is doing its best to expand the number of clinics, there are concerns that the measures are still not keeping pace with the current surge in cases. As of Sunday, close to 13,000 patients are being treated at home. This is 79% of the 16,000 patients medical institutions can handle. With the rapid increase in infections, the medical system is currently facing challenges to deliver oral treatment and home treatment kits in time.
Well, let's hope the new measures get systemized as soon as possible. Thank you so much for your report, Min-jung.
Thank you.